Chiropractic is not what it used to be. Now that's quite a title, and I'm sure I have fellow chiropractors sitting here watching with a skeptical eyebrow raised up right here from the start. Hey everyone, this is Dr. Jeff Williams with Creekstone right here in beautiful Amarillo, Texas, and I'm coming to you with a new video this week. If I have had a problem in my life, it has been that I tend to speak my mind rather than suppress my thoughts. Now, sometimes that's an excellent trait, sometimes it's not. Ultimately, my goal is to educate my population to the best of my ability, using the knowledge I've gained in over 23 years since I graduated from chiropractic school. And since we're talking about it, maybe that's where we'll just begin, okay? When I graduated from Parker College of Chiropractic in 1997 down in Dallas, Texas, the school was full of amazing classes. Now, many folks don't have reasons to be aware of this, but a chiropractor's education is pretty extensive. We literally have the exact same course load, basic sciences, that you'll find in a medical school. It's still like that, right? That part hasn't changed. Chiropractors have a challenging course load, and I'm talking about classes like physiology, gross anatomy, which is dissecting human cadavers, biochemistry, cell biology, bone pathology, radiology, neurology, systemic anatomy, histology, and embryology, all these ology names. These are just a few of the ridiculously hard classes that we took and conquered, and I'm proud to this day that my colleagues and myself survived. There were also a lot of technique classes to learn how to move the bones around, and those were the fun classes. And when you have as many as 33 college hours in one semester and you survive that, well, it's quite an accomplishment. And while we were exposed to so much evidence-based science in our school, we were also exposed to a lot of things that science has really yet to back up. Things like the idea that a patient needs to be seen by a chiropractor once a week or once every other week for the entirety of their lives. The idea being that everything running your entire body comes from the spine, and that if you keep everything straight and the holes open up that the nerves run through, well then a person will never get sick, will never require vaccination, and will function at the peak of their abilities. And just by having the spine adjusted, no other intervention. So these are the ideas the profession was founded on back in the late 1800s, and the ideas that continue to permeate the profession, although to a much lesser extent here in 2021. Now, to be fair, doctors of osteopathy, they're now doing surgery, and they enjoy equal footing with their medical doctor colleagues. But their founder, way back in 1874, he believed that all elements of a person's body, mind, and spirit had to be incorporated into the total care of that person. That's still valid. He believed that the body had self-regulatory and self-healing powers, that the body contained within it all the substances necessary for maintaining health. And when the body was properly stimulated, he believed that these substances would also assist in recovering from illness. Now, that sounds a lot like chiropractic, a lot of like how chiropractic was originated as well. Not a lot of difference in that thought process. Now, you may have also heard that those in the medical field once believed in bloodletting and leeches and lobotomies. Well, healthcare is steeped in science, and it is my belief that it should be led by science. The treatments and the thinking should be continually updated and upgraded as the science progresses and as the science demands. Now, for the most part, that is exactly what we see happen with healthcare disciplines. Take the creation of the mRNA COVID vaccine in 2020. That is a feat that would have been unthinkable just 15 years ago, probably even just 5 years ago. So there's no argument that the late 1800s had a good amount, when these things were coming about, in that day and age, there was a good amount of overreaching generalizations, philosophy, and vitalism as These people were looking for bigger and better ways to treat the body, to treat illness. Unfortunately, I've seen several times over the years in online chats and comments or articles where chiropractic detractors have attempted to delegitimize the chiropractic profession by attacking its origins, all the while completely forgetting the origination and history of their own favorite disciplines. That is the very definition of bias. We all had a starting point. Now, getting back to chiropractic specifically, as a result of exposing future chiropractors to more vitalistic thoughts and ideas like this in a collegiate setting, many different styles of chiropractors were produced over the years. For simplicity purposes, I've really tried to boil these down into just three camps, if you will. Three types of chiropractors. And my goal is not, here I'm not trying to go at intraprofessional bashing, right? So I'm going to try to curb any criticism as I describe them. And I want to be honest in my own perception though, right? I don't want to hide my opinion on the thing. My goal, as I have said, is to educate the layperson on the varied flavors of chiropractors. So they are as follows: evidence-based, patient-centered chiropractors. That's number one. Number two, agnostics. And number three, philosophy-based chiropractors. So let's discuss each one of them. Let's start with number one, the evidence-based, patient-centered chiropractor. As full disclosure, and in an effort to be transparent about my biases, this is the type of chiropractor that I am, an evidence-based, patient-centered chiropractor. And an evidence-based, patient-centered chiropractor really searches out the latest research. They pay attention to the newest recommendations and the newest treatment guidelines that pertain to their profession and their treatment. They allow their thinking and their treatment approaches to be guided and altered by the latest and newest research, the latest information. They look for the best of the research according to the research pyramid. For example, case studies and pilot studies, they just don't mean as much as randomized controlled trials, systematic reviews, and meta-analysis. I'm not trying to get over your head, I'm just saying there's different levels of research. Now, patient-centered means that the practitioner would never perform treatment that likely wouldn't help the patient, just so that they can make more money for their clinic. When practitioners bill things in the best interest of the clinic and the clinic's financial statistics rather than in the best interest of the patient, then that's not patient-centered. That's called doctor-centered. Now, while it seems silly to have to make this distinction here, through all healthcare disciplines, this is an unfortunate fact of life. Doctors of all stripes are found doing things that are motivated financially rather than in the best interest of the patient. Now, when we put the patient and their needs first, we will almost always make the right decisions. Me personally, I make sure that that is a keystone of my practice, and I do that by asking myself, if this patient sitting here right in front of me were actually my family member, my daughter, my son, my aunt, my grandmother, my grandfather, my uncle, if this person sitting in front of me were a family member, how would I advise them? Now, this has been my guiding principle my whole career and has yet to let me down. It's a good way to go about things. Now, number two, the agnostic chiropractors. This group of chiropractors, they got out of school, they started a practice, and they're just surviving, and they're doing their very best from day to day. They want to do a good job, and they typically do. They get their patients better for the most part. While they try to keep an eye on new and emerging research and information here and there, they're not necessarily guided by it and not always that interested in furthering their learning or education through the years of their professional development. They graduated, they started a business, they're taking care of patients, and they're just making a living. It's that simple. They do the minimum to meet the requirements to maintain their license, but typically not a lot more. They do not necessarily buy into all of the more philosophy-based parts of the profession, but they also have not bought into the evidence-based side completely either. They're essentially agnostic. They exist somewhere in the middle ground. And then our third group here, I call the philosophy-based chiropractors. This group of chiropractors takes the founding principles of the profession from the late 1800s and they hold tightly to them. As research furthers our understanding of neuromusculoskeletal pain and the treatment, philosophy-based chiropractors tend to follow the notion that adjusting the spine regularly is all a patient needs to stay completely healthy. This type of practitioner commonly makes claims to fix just about anything and everything through adjusting the spine. Everything from ear infections and asthma to cancer and colic. They commonly advise patients against vaccinations because they claim that if you're adjusted regularly, your body will fight off measles, smallpox, polio, tuberculosis, and even COVID. And while they may offer some favorable case studies here and there, as far as research goes, there is no high-level research that I'm aware of or have seen, and I'm aware of a lot of research. I'm not aware of any supporting these ideas in any meaningful way. To dive a little deeper on the thought of consistent adjustment throughout one's life, I would offer the idea that being adjusted too often over a long period of time may actually be detrimental and can lead a patient into long-term pain. So let me explain that. When I was a kid, I started popping my own neck after I went to a chiropractor for the first time. I thought it was cool and it felt good. And it started off being difficult to accomplish in the beginning. It was hard to get your neck to pop at first. Well, then it got really easy to do. In fact, it started popping on its own without me even actively trying to do it. Now, is that a good thing or a bad thing? Self-adjusters pop their own neck often enough, they eventually destabilize that area of the spine. By destabilize, I mean more movement. They loosen the connective tissue and the tiny little muscles that hold everything so tightly. And that's why it gets easier and easier to pop the area the more that it's done. Now you should understand why a spinal surgeon fuses areas together, okay? They do that because there's too much movement between the joints of the spine, and that movement causes constant irritation of the joints. Basically, the looser your spinal joints become, the more movement in your spine, which means more consistent irritation and potentially pain, long-term pain. So it makes sense that continually having adjustments weekly or bi-weekly for life would eventually lead to some destabilization and some increased movement, some instability. As you've likely guessed by now, that would lead to some amount of instability and ongoing pain, as I've said. While there are different kinds of philosophy-based chiropractors, some focus on the sore spots there in the spine only, without much regard to the deeper, bigger, more concerning or sinister issues that could be going on with a patient. Only focusing on certain spots in the spine could lead to missing some really important stuff. For example, I saw a post from a philosophy-based chiropractor a month or so ago on Facebook. In the post, the chiropractor was bragging about seeing 99 patients and 9 new patients within only 3 hours, all by himself. Not only was he bragging about this stuff, but was also offering to teach others how to do the same thing. He wants to be a coach, a mentor. So I covered this extensively in my weekly evidence-based chiropractic podcast called Chiropractic Forward, but I'll cover it here briefly as well. Basically, I spent time crunching these numbers. It's not hard to figure out how many minutes you have in 3 hours, right? If each of the 99 established patients took an average of only 1 minute to treat from start to finish for each patient encounter, which that's still substandard, by the way, only 1 minute per patient, like assuming they have no questions you need to answer, they're just in and out and you did your business and that's it, 1 minute. Then that leaves 81 minutes to examine and evaluate the 9 new patients, which means Per new patient, he has roughly 10 to 15 minutes for each new patient. In all reality, he probably had much less than that. But let's assume, best case scenario for this particular situation, that's 15 minutes. 15 minutes at best to do a lot of stuff. Things like review the history taken by the staff before he came in. Review the range of motion if taken in advance by the staff. Review the patient's vitals. Meet the patient and listen to their story. Assess the patient's gait. Assess standing posture. Check yellow flags and discuss any of those that are present with the patient. Check for red flags. Not everybody needs x-rays. Check reflexes. Check dermatomes. Check muscle strength. Check neurodynamic positions for radiculopathy. Assess for Ehlers-Danlos and hypermobility. Check the orthopedic testing. Make sure you do the neurologic testing. Check for extension flexion bias positions. You want to make sure we don't have a disc going on. Come up with an accurate diagnosis. Educate the patient on their diagnosis. If chronic pain is part of the case, well, he needs to educate on central nervous system upregulation and the biopsychosocial aspect of pain. Well, that's at least a 5-minute conversation. Teach proper movement and biomechanics to remove the daily pain triggers. He has to answer questions that the patient might have. That's a lot of stuff, and that's not even all of it, really. I mean, that's just what I could think of. Now, for comparison purposes, my new patient process takes roughly an hour to an hour and a half. As you might imagine, 15 minutes at best to process a new patient, it's just not something I can support. In my opinion, it's not enough time and it's not enough attention to do a good, professional, and responsible job, not one that is worthy of being called a doctor. As with everything else in healthcare and outside of healthcare, there will be the good and there will be the bad. And I'm happy to let you decide which this is for yourself. Now, that podcast episode can be found at chiropractic4.com, and it's titled, "Some Chiropractors Could Be Better," because they could. Now, getting back to the original title of this article, as with other professions in the healthcare field, chiropractic has also progressed for the most part. The profession has progressed from being only concerned with spinal adjustments and its origin to now having the ability to say that chiropractic is not a treatment modality as it once was. Now chiropractic is a profession with lots of treatment modalities that fall within its scope and boundaries. Treatments like spinal manipulative therapy, of course, that's what we've always been known for, right? Exercise. We make a huge deal of exercise. Muscle work, proprioceptive training, acupuncture, low-level laser, non-surgical spinal decompression, sports prep and recovery, therapeutic modalities, instructions for things like biomechanics, instructions for posture and ergonomics, balance work, and much, much more. And you can see there's been an obvious progression from chiropractic's beginnings to where chiropractic is today. Not only that, but spinal manipulative therapy, exercise, muscle work, acupuncture, and low-level laser have all been recommended by the American College of Physicians as first-line therapies for back pain. Just 15 to 20 years ago, you would never have imagined that a medical entity of the status of American College of Physicians would ever dream of recommending spinal manipulative therapy as a first-line treatment for back pain. It just wouldn't have happened. But research says that is what's effective, so they had to upgrade. And once again, chiropractic is not what it used to be. Chiropractic is a big profession with lots of tools in the toolbox and a high level of education that can be leveraged in the patient's best interest to get them better, faster, and back into their lives. Now, back into their lives, that looks a lot different for different people, right? A high school athlete performing better may be the way that manifests itself in that demographic. But getting back to your life may mean that a grandma is able to keep up with the grandkids a little bit better. Maybe grandpa can get on the floor and get back up without worries. Either way, The right kind of chiropractic doctors have the tools to help you make it happen. For me, that is an evidence-based, patient-centered chiropractor. Again, this is Dr. Jeff Williams with Creekstone. If you're watching this on YouTube, a comment, subscribe, and a share, those are all wonderful things. If you're watching on Facebook, a like and a share are equally amazing. If you're from the Amarillo area or you're going to be traveling through, you need to be seen, call us at 806-355-3000 and let's get you on the schedule. Until next week, y'all stay awesome. We'll see you then.